This is section 11. I will be discussing assessment and management of clients during the Puerperium. This section discusses care of the client in the Puerperium. It will include perineal care and examination of the puerperal woman. By the end of the section, the student will be able to conduct assessment of clients during the Puerperium, provide immediate care for clients during the Puerperium, and provide subsequent care for the clients. The reading list. The Puerperium begins immediately after delivery of the placenta. The care entails both the 4th stage and then the subsequent care till the baby is 6 weeks after delivery. The nurse or midwife must estimate accurately the amount of blood loss to inform appropriate management. Any change in the condition of either the mother or the baby should be detected and interventions implemented. The 4th stage. We all know that the 4th stage follows directly after the 3rd stage. And just after the woman has delivered and the placenta is completely delivered, we check the vital signs of this woman, and then we observe the general condition of the mother and baby. We assist the mother with her baby and transfer mother to postnatal ward. So once she is stable on the lower ward, we have examined and we are sure that her condition is good, baby's condition is also good. We transfer the woman to the postnatal ward. Now, if the baby's condition is not good after resuscitation, then we may take the baby to the NICU and the woman is still sent to the postnatal ward. Now, we allow the father or any other significant others to see the mother and the baby. And depending on the protocol, you may check RBS for mother and baby as prescribed. You may observe mother for any blood loss, estimate the amount of the blood loss, and then you document. If there is blood loss, palpate to rule out retained products. You take the mother how to massage her own uterus. You check fundal height. Ensure that uterus is well contracted. You check uterine contraction quarter hourly for 2 hours. Then every 30 minutes for 1 hour. You encourage mother to empty bladder frequently and remove soiled linen immediately they are soiled. You administer IV fluids as prescribed. In normal delivery, if it's just spontaneous vaginal delivery and there is no abnormality, there may not be the need to administer any IV fluids. If it is a cesarean section, then during the 4th stage, there may be the need to administer IV fluids. Sometimes it may also contain some oxytocics during the 4th stage if the woman is bleeding. Observe for the amount and color of lochia. Observe whether baby has passed meconium. And you place baby beside mother in bed. You teach mother to perform perineal care. You repeat Abgasco. Now you perform head to toe assessment of the baby like we've done earlier on. And you observe the mother to detect any change in her condition. Sometimes she was transferred to the postnatal unit. She was very firm. She was good and the condition was stable. But then she begins to bleed. And remember that of late, bleeding after the 4th stage or during the 4th stage has become very common and a common cause of maternal mortality. You check vital signs, you administer any prescribed medication, you encourage the mother to continue feeding the baby on demand, and then you tell the mother to begin eating a highly nutritious diet. You assist the mother with positioning techniques during breastfeeding. Explain the importance of breastfeeding. Instruct the mother to expose her breast, keep her breast in good condition, and post-operative mothers assist mother into a sideline position. If the woman had a spontaneous vaginal delivery and wish to feed, here we advise that anybody is supported to ideally breastfeed the child. There are various ways by which you can change the position during breastfeeding, and this helps relieve aches from the woman's back. And then there are various positions. You can have the cradle hold, you can have the football hold, you can also have the cross cradle or modified cradle hold. Now you've done the feeding techniques also in pediatrics, so there is no need to go through much into the feeding techniques. The most important thing here is that you instruct the mother or you teach the mother how to burp the baby. and you encourage the mother to continue feeding, and then also ensure there is bonding and adequate rest and sleep. So anytime baby finishes feeding, you wrap the baby and put the baby beside the mother. You replace any articles and record the time and duration of feeding and any other observations made during the 4th stage. Now you demonstrate cord care. Because the woman will be taking the baby home, you teach the woman how to go about dressing of the cord. Now there are so many discussions going around cord care. Some facilities are still using spirits. Some have also gone off spirit to use normal saline. Now some are also talking about using boiled water, which has been allowed to cool off. So depending on the protocol, you dress the cord as such. And you may obtain blood and urine sample of mother for lab investigations. In some facilities, once you go through delivery, they ask you to do a full blood count and then urine RE. You obtain baby's blood sample for prescribed laboratory investigations. This is also not routine. Some units, you take the blood of the baby routinely for sickling and blood grouping. Others don't do it. Perform wound dressing provided necessary. That is, if it's not a cesarean birth, then if there is a need to reinforce the dressing, then you may have to do that. You wrap the fundus of the woman to expel clots. Now, preparation for discharge, you advise the woman on all the things listed up here. If she's going home, perineal care, personal hygiene, exercise, drugs or medications, nutrition, postnatal clinic, times you have to come for review, how to care for the cord, clothing of the baby. Sometimes you see the mothers in this hot sun giving the babies 3 layers of dresses with the cat suit and everything, with mittens and all that. And that's our weather. We may not dress typically as people dress outside. And the mother should be educated as such. Breastfeeding, educated on the importance, baby sleep patterns, immunization of the baby, family planning, resumption of sexual activity, which is also very important. Now, depending on the time for discharge differs from place to place. People just discharge after the 4th stage. Others also go beyond the 4th stage. So in conclusion, for the 4th stage, effective management of the 4th stage of labor is crucial to promoting health outcomes. The observations are very, very important. Deviations from normal should not just be noted, but then you have to intervene immediately. The mother is assisted to return to normal functioning, and finally the woman is educated before discharge to facilitate continuation of care and prevent any complications. For assignments for this topic, you visit the maternity home, your facility, conduct immediate and subsequent management of a client during the 4th stage of labor. Now, when the 4th stage is over, the subsequent care is just like we have said for the 4th stage. So we are imagining that this woman is staying for some reason beyond the 4th stage. So most of these things are repetitions of the things you did in the 4th stage. So the 4th stage was the immediate care, and then this is the subsequent care. You continue monitoring the vital signs. Now you are checking evolution of the uterus. Is the uterus returning to its pre-gathered state? You check that. You examine the breast daily. You examine and you observe breastfeeding patterns. Has she got any difficulty, any engorgement? You encourage good nutrition and the intake of copious fluids. You encourage adequate rest and sleep and ambulation. Encourage woman to solicit for support with her house chores. If she needs to bring in any other family member to support her, she does that. You provide pain relief for after pains, and you educate on maintaining personal hygiene. Educate the woman on danger signs. Now you perform a complete physical examination on both mother and baby before transfer. You provide family planning before discharge. So you don't just give education. If you have, the woman makes the choice, then you give it to her right in the facility before she leaves the hospital, and this is the current practice. Assess the psychological state of the woman. Check if baby have received all due immunizations. You educate the mother on care of the cord, nutrition, Vitamin A is given to the woman depending on the facility. Provide appropriate medication. Some, for routine, they give some antibiotics when the woman is discharged from the labor ward. So you do that. You ask the woman if she has any concerns and address them immediately. And then you make appointment for the next visit. Now, perineal care is also very important because if the woman is not able to handle herself very well, keep very good hygiene, she goes back and comes back with all type of infections during the puerperium. It is therefore important that you maintain good perineal care. So you may do vulval toileting, especially if the woman is staying beyond the 4th stage and it's been admitted for days, then you may do the vulval toileting. If she is leaving early, then you teach her how to wash herself, how to change the pad frequently, and how to keep the place as dry as possible. Remember that this woman is discharging lochia, and because of the fluid, it becomes a very good medium for any bacteria to thrive. It's important that she change the pad frequently and clean the place, and then maintain dry pad or maintain clean pad all the time and discard immediately it is wet. So if the woman is staying in a cesarean section or she has infection and has been kept on the ward for some reason, then you follow the steps to provide vulval toileting. But vulval toileting is not a routine care for every woman who delivers. Now you want to look at examining the puerperal woman. You explain the procedure to the mother and ask her to empty the bladder. You provide privacy and assist her into the dorsal position. You wash and dry hands and examine the hair and scalp. You examine the conjunctiva, the mouth and tongue. You examine the arms and hands and fingers. You examine the breast. You examine the abdomen. Palpate the uterus and measure fundal height. Examine the legs for pain, especially in the calf muscles. Then you wash and you put on gloves. Now you tell the woman to part the tie and expose her vulva. Then you remove the pad, or you can even ask the woman to remove the perineal pad herself. Then you inspect the lochia, the vulva and perineum, and then you change the sanitary pad. If you inspect the lochia, look for the amount of discharge, look for the color of the discharge. We know the lochia should be changing from rubra to serosa to alba, depending on the day of the puerperal stage. So you check and compare with the date and see if that is the appropriate type of lochia that the woman should be discharging. And then you also look at the odor. If it's offensive, it tells you this woman is possibly having some infection. You examine the sacral area for edema, and then you make this woman comfortable and assist her to get up. You remove the glove, you wash and dry your hands, and you record all the findings, including any abnormalities that you found during the examination. This brings us to the end of our session, and these are our references.
Hello class. Today I'll take you through the examination of the puerperal woman. When you have a puerperal woman that comes to your clinic, you welcome her, offer her a seat, then you explain procedure to her, make sure she consents. After that, you ask her to empty the bladder and help her to change into a gown and put her in the dorsal position and make sure she's comfortable. You go out and wash your hands and you dry and make sure they are warm. You start the examination with the head. So you examine the patient's hair for any lesions, any dandruff, lice, and all the abnormalities that you can find on the hair. The texture and the distribution of the hair around the head. Unfortunately, this dummy doesn't have hair, so we will move on. Then you come to the eyes. You examine the eyes to rule out jaundice and anemia. So you examine the conjunctiva for pallor and the sclera for jaundice. So you make sure you pull the conjunctiva down so that you can have a very good look. You examine the nose for patency and discharge. The ears for the same purpose. The mouth, you examine the mouth for any crackness, sore around it, any dryness of the lips. From the head, you move to the upper extremities. That's the hands. So you examine patient's hand. Make sure you still provide privacy without unduly exposing the woman. So you examine the hand for any varicosities, the nail beds. You press to examine pallor, that is capillary refill of the nail beds. You do same for the opposite hand. We come to examine the woman's breast, but you expose a breast at a time. So you examine the patient's breast, you palpate, you rule out for pain, soreness of the nipple, engorgement of the breast. You make sure the woman is lactating. Then you look for any changes and abnormalities of the breast. Are there any masses? Is the patient feeling any pain? So you palpate and rule out all those things. Then you palpate and examine the other breast as well. So you palpate, you look for all the things that I was looking for. Then you come to the abdomen. You examine patient's abdomen. You look for the fundal height. Then you palpate to see if uterus is well contracted. You rule out any sub-involution, any tenderness, any enlargement of the spleen and the liver. Then you measure the fundal height with your tape measure. So you look for where the fundus is. Then you measure it to the symphysis pubis. Then you note the measurement and you will record it later. You cover your patients nicely. Then you come to the lower extremities. You expose the woman, examine the thigh. Then you examine the legs and the calf so that you rule out any pain and tenderness, because there is a tendency that the woman may suffer from deep vein thrombosis. So you make sure you rule out all those signs. Then you examine the other leg as well. Then you cover the woman. You tilt the woman and examine the back. You rule out any sacral edema or any pain around the patient's back. After all this, cover the woman nicely. You go out and wash your hands and wear a glove. Then you come back and examine the perineal or the vulvar area. Examination of the perineal area. The woman has a pad on when she comes. You pick the pad, then you examine the pad. You look for the amount of lochia that is there, whether it is the right amount, the color, the consistency, the odor. So you have to smell it, the odor, then you dispose of the pad. Then you examine the perineal area. You pat to see signs of any inflammation, any scars or tears. You look if she had episiotomy, whether the wound is healing well. Is there any gaping? Are there signs of infection? You examine all that. Then if there is any discharge, any foul smell, you take notes of all those things. Then after that, you place a new pad at the perineum. Then you cover her nicely. Then you thank her for her cooperation, discard your items. Then you come back and explain the findings to her and you document. Thank you.